In fiscal year 2021, through the Substance Abuse Prevention and Treatment Block Grant Program COVID-19 Supplemental Awards, the Ohio Department of Mental Health and Addiction Services, Ohio University's Voinovich School of Leadership and Public Service, and the Pacific Institute for Research and Evaluation came together to provide support to 5 urban behavioral health boards in Ohio as they engaged in community-based processes to address the impact of social determinants of health when planning for substance use disorder prevention and mental health promotion services and programming. This Community Collective Impact Model for Change 2.0, addressing social determinants of health in minority and underserved communities, was unique because the urban behavioral health boards received phased funding. Project directors began Phase 1 by working to bring together people and groups who had lived experience with health disparities and social determinants of health. Collaboratively and iteratively, community work groups created a data-driven impact statement in Phase 2. From this impact statement, work groups then created 3-year prevention services plans, detailing the goals, objectives, and action steps to be taken to address a specific social determinant of health within an identified priority population as the final initiative phase. The series of videos that follow were created by the communities for the communities and highlight the 3 phases of this initiative through photo voice, ethical photography for social change.
Mahoning County, SDoH Grant Impact Statement. As we address social determinants of health, Mahoning County recognizes the need in underserved communities to reduce stigmas surrounding availability and access to healthcare services, including mental health services, by providing resource fairs, trainings, and an anti-stigma campaign initiative. Take that step. We will help individuals in our underserved populations understand that resources are available and accessible, enhancing the upstream social environments in healthcare, education, and social services.
That's why we're here, all right? We will help individuals in our underserved populations understand that resources are available. I am the Community Engagement and Outreach Coordinator for the Mahoning County Mental Health and Recovery Board. That is my title. I love doing this work because I just want to help people. We do this day in, day out, and you do it, right? To just help people and impact change. I'm a project director and goalie status of Office of Authority Health for Youngstown City Health District. She is the other project director for this grant.
What happens is, like, when we are out at, we do a lot of resource fairs, community events to make sure that people understand what help is available. And so everywhere we've gone, every event that we've participated in, people come up to us and say, either I didn't know this was available, or they'll say, I really need this help. Thank you, for sharing these resources with us. Or we'll have to, make sure they know, okay, I know that there's help available, but you have to take that step, to access those resources.
This is our work group, okay? So we have Joseph Oka, Elizabeth, Jamil, they're from Youngstown City Health District. And I have to work with my partner, Mr. Bernie Concern, the Community Initiative to Reduce Violence. Okay, this is our work group for our grant, and we've been working hard.
So, like, everywhere we went, and that's how we developed in our prevention services plan. That's how we developed, the Take That Step campaign, because our whole messaging is to the people that in our communities that we serve, to the individuals in the community, and it expands. It doesn't mean, I know our grant targeted underserved and minority populations, but at the same time, everybody can benefit taking that step. Everybody in whatever capacity you need help, it spans across all, racial backgrounds, cultural, financial backgrounds, doesn't matter. If people need help, they need help.
The work we've just seen was guided in part by the CDC resource titled Promoting Health Equity, a resource to help communities address social determinants of health, which describes how considering the impact of social determinants of health when planning for prevention services can improve health outcomes and promote health equity across the lifespan. Additionally, the Ohio University and PIRE teams provided training, technical assistance, professional development, and networking opportunities. The results represent a truly community-led initiative focused on actualizing the impact statements to work towards health equity in each community.